You're scrolling through social media and you see it. Tinnitus increases dementia risk by 68%. Your heart sinks. You've had tinnitus for years. Does this mean you're destined for cognitive decline or dementia? Well, take a breath, because what you're seeing online is taking research out of context and leaving out the most important part of the story. I'm Dr. Layne Garrett, and I've been treating tinnitus and hearing loss in Utah for over 20 years in my clinic. Every week, someone comes into our clinic worried about this exact thing, and today I'm going to walk you through what the research actually shows, why you shouldn't panic, and most importantly, what you should do about it. The short answer: tinnitus itself doesn't cause dementia. But there is a connection you need to understand, and it's actually good news, because it means there's something effective you can do about it. First, let's talk about the studies that are causing all of this concern. A 2021 study from Taiwan found that people with tinnitus had a 68% higher risk of developing early onset dementia. Now, that's dementia diagnosed before the age of 65. And another 2024 study from Taiwan showed similar results for people aged 50 to 64. And honestly, when you read the headlines, that sounds terrifying. But when someone comes to me worried about these studies, I need to explain what the research really shows, and more importantly, what it does not show. These studies found a correlation. That's not the same thing as causation. Correlation means two things happen together. Causation means one thing directly causes the other. And distinguishing between the two of these things is absolutely critical when we're talking about your health. Think of it this way: ice cream sales and drowning deaths are correlated. They both go up in summer, but ice cream doesn't cause drowning. Then there's a third factor: hot weather. That explains why both things happen at the same time. The same principle applies here. Tinnitus and dementia might both be connected to something else, and when we dig into the research, that's exactly what we find. What drives me crazy about how this gets reported online is that everyone focuses on the tinnitus and ignores the elephant in the room: hearing loss. More than 90% of people with chronic tinnitus also have some hearing loss. Sometimes that hearing loss is obvious, sometimes it's subtle enough that people don't even realize they have it. It might not even show up until we do ultra-high frequency testings that standard hearing tests don't look at, or it might be nerve damage that doesn't appear on a regular hearing test. Now, hearing loss and dementia, that connection is solid. The 2024 Lancet Commission on Dementia, which is basically the most authoritative review of dementia research in the world, identified hearing loss as the largest modifiable risk factor for dementia. Not tinnitus, hearing loss. When they analyzed all the high-quality studies, they found that hearing loss accounts for 7% of all dementia cases globally. That's more than any other modifiable risk factor. Bigger than smoking, bigger than obesity or physical inactivity. When you have hearing loss, your brain works harder to process sound. You get less auditory stimulation, and you often become socially isolated because communication becomes difficult. All of these are also risk factors for cognitive decline. So when studies find a correlation between tinnitus and dementia, what they might actually be finding is that hearing loss, which often comes with tinnitus, is the real driver. And we have direct evidence for this. A large 2024 study from the United Kingdom Biobank, which followed over 500,000 people, found that when you control for other factors properly, tinnitus itself was not independently associated with an increased dementia risk. The risk was coming from the hearing loss and aging, not from tinnitus. Now, before we keep going, if you're getting value from this video, do me a huge favor. Hit the like button right now. It actually helps other people who are worried about this stuff find accurate information instead of all those scary headlines. And subscribe to our channel if you haven't already. I do videos like this twice a week, breaking down the real science between tinnitus and hearing loss, so you know what's actually true versus what's just internet fear-mongering. All right, let's keep going. This is where the story gets encouraging, because unlike dementia itself, which we still can't cure or prevent directly, we can treat hearing loss, and treating hearing loss appears to reduce the risk of cognitive decline. The landmark study here is called ACHIEVE, the Aging and Cognitive Health Evaluation in Elders. This was a randomized controlled trial involving near 1,000 older adults with untreated hearing loss. They followed these people for 3 years. What they found was remarkable. In the group at higher risk for cognitive decline, these were older adults who already had some risk factors like diabetes or high blood pressure. Treating their hearing loss with hearing aids reduced their rate of cognitive decline by 48% compared to the control group. That's huge. We're talking about cutting cognitive decline nearly in half just by addressing the hearing loss that's also causing the tinnitus. The researchers think this works through multiple pathways. When you treat hearing loss, you're reducing that cognitive load on the brain. It doesn't have to strain to process sound anymore. You're providing the auditory stimulation the brain needs to maintain those neural pathways. And you're keeping people socially engaged because communication gets easier again. The 2024 Lancet Commission reviewed this evidence and concluded that the evidence that treating hearing loss decreases the risk of dementia is now stronger than when our previous commission report was published. They specifically noted that hearing aids appear particularly effective for people with hearing loss who have additional risk factors for dementia. And when people come in worried about their tinnitus, treating their hearing loss often helps the tinnitus. The brain gets the auditory input it's been missing, and that phantom tinnitus sound often becomes much less bothersome. Now, this isn't just my clinical experience. It's supported by medical guidelines. The American Academy of Otolaryngology Head and Neck Surgery published clinical practice guidelines for tinnitus that specifically recommended that clinicians should recommend a hearing aid evaluation for patients with persistent, bothersome tinnitus and documented hearing loss. When the major medical organizations for ear, nose, and throat physicians makes that recommendation, it tells you the evidence is solid. Research shows that about 75% of people with both hearing loss and tinnitus get meaningful relief when their hearing aids are properly fitted with real ear measurement verifications. But I need to be honest with you about something. Hearing aids alone aren't always enough for comprehensive tinnitus treatment, and that's why a lot of people get frustrated. They get hearing aids from a clinic that only offers the hearing aids, but they get some benefit, and then they're still struggling with their bothersome tinnitus. In my clinic, when someone has persistent bothersome tinnitus, hearing aids are typically the foundation of treatment, but they're part of a broader treatment plan. The American Academy of Otolaryngology Head and Neck Surgery guidelines also specifically recommend cognitive behavioral therapy for persistent bothersome tinnitus, not just hearing aids. So, what comprehensive treatment actually looks like for tinnitus? We start with properly fitted hearing aids, but we also provide education about how tinnitus works and why your brain is reacting to it. Understanding the mechanism helps reduce anxiety. We incorporate elements of cognitive behavioral therapy to address the thought patterns and emotional responses surrounding your tinnitus. For many patients, we also add advanced treatments like Layne, which is approved by the FDA for treating tinnitus. That's a bimodal neuromodulation therapy that uses tongue stimulation combined with sound therapy that helps retrain your brain's response to the tinnitus. And now we can use objective measures like heart rate variability to actually track whether treatment is working, not just asking, how's the tinnitus sound now? We want to see measurable changes in how your nervous system is responding to the tinnitus. This is why I see success rates approaching 90% with comprehensive tinnitus treatment compared to just hearing aids alone. We're addressing the multiple factors that make tinnitus bothersome, not just amplifying sound and hoping for the best. So if you have tinnitus, what should you do with this information? First, don't panic. The tinnitus itself is not causing dementia. You're not destined for cognitive decline just because you have ringing in your ears. But do take it seriously as a sign that you should get your hearing checked. Even if you think your hearing is fine, get a comprehensive evaluation. That means testing that goes beyond the basic frequencies of pressing the button when you hear the beeps. You need to find out how your inner ear is functioning, seeing if there's any hearing loss that might not be obvious in everyday situations. And if you do have hearing loss, addressing it isn't just about hearing better today, it's about protecting your cognitive health in the future. And the research shows that earlier intervention is better. Don't wait until your hearing loss is more severe. And if you have persistent bothersome tinnitus, don't settle with the phrase, learn to live with it. There are evidence-based treatments that work, but provider selection matters. Not every audiologist specializes in comprehensive tinnitus care. Look for clinics where their providers have advanced training like the certificate holder in tinnitus management from the American Board of Audiology. Check whether they offer multiple treatment approaches beyond just hearing aids, things like cognitive behavioral therapy education, FDA-approved treatments like Layne, and that objective monitoring of heart rate variability I mentioned before. Make sure they do proper hearing aid verification with real ear measurements as well, and ask if they can coordinate with other specialists when needed. Because if all a clinic offers is hearing aids, that might be all they can do, even when your situation calls for more comprehensive care. So the bottom line is this. The research does not show that tinnitus causes dementia. What it shows is that hearing loss, which often occurs with tinnitus, is a major modifiable risk factor for cognitive decline. And the really encouraging part is that treating hearing loss with hearing aids can significantly reduce that risk. For many people with tinnitus, comprehensive treatment that includes hearing aids plus other evidence-based approaches provide the best outcomes, both for the tinnitus and long-term cognitive health. So again, if you have tinnitus, use it as a motivation to get your hearing checked and addressed if needed. But don't lose sleep over the headlines that oversimplify research. This is a case where understanding the science actually gives you power to do something about it. Now I want to hear from you in the comments. Have you been worried about the tinnitus dementia connection? Has anyone told you to get your hearing checked because of concerns about cognitive health? Let me know below. And if you want to learn more about comprehensive tinnitus treatment approaches, I've put together a free online learning center with detailed information about evidence-based treatments and what actually works versus what's just marketing hype. You can find that link in the description below. And if you're here in Northern Utah and want a proper evaluation of your hearing and tinnitus, not just assumptions, but actual comprehensive testing and treatment, you can schedule an appointment with us at Timpanogos Hearing and Tinnitus in our clinics that are found in American Fork or Spanish Fork. We specialize in comprehensive tinnitus care and have helped thousands of people find real relief. That link is in the description too. Thanks for watching. I'll see you in the next video.